Greetings. My project examines the role of risk perception in African American women who are HIV or AIDS positive. It is a harm reduction project that began by interviewing both practitioners who work at medical clinics and hospitals, as well as patients who are impacted. So, why this project? It's quite simple. African American women are still testing positive at an alarming rate, and I wanted to examine the disparity while looking at what's being done for harm reduction. After decades of community based interventions and research, they're still being affected at a rate somewhere 17 to 20 times greater than white women. Many of these disparities are directly attributed to the numerous social determinants of health that have affected African American communities, including racism and unaddressed trauma. For the sake of time, we won't have time to show all of the interviews with the consumers, but some of the data gathered gave us an insight on both how they contracted the virus, how they are living with taking medication, and how they are spreading the word about harm reduction. Additionally, in the photos below, you can see I'm speaking to the head of the medical department at the centers as well as the vice president of the centers, talking about what their nine staff do specifically related to HIV harm reduction. From there, I took a tour of the harm reduction facilities, and I'll show you in the next slide what that harm reduction toolkit is comprised of. They load up their van, and I had an opportunity to follow some of this, and they go out and distribute these kits in the hopes of preventing the spread of HIV amongst the targeted population and others. Of all the interviews conducted, I think I gathered approximately 10 hours worth of footage. This one was one of my favorite. When I called her, she invited me to her home and we talked extensively about um, what testing has been like. In her career, she says that she tested 10 to 20, I believe she says 20 people, African American people positive a year. And so when she added up those numbers, I talked to her about what it felt like to give positive results and what those family members were doing to prevent it from becoming a reoccurrence for other members who might have risky behaviors. So I did select one of her, just a small snippet to share.
I think in the Black community, we have to understand that we can't expect people to come and save us. We need to save ourselves. And if we're testing positive at this alarming rate, that means that there's somebody that's willing to go back and talk to others and pull each other's up, other people up. I believe in peer-to-peer counseling. I believe in people listening to people that have had experiences and overcame those experiences. I think that's really important. I don't think that people learn from someone telling them something that they can't relate to. So one black woman to another black woman, or one black girl to another black girl, will be very influential and effective, I believe, in our community.
So there's absolutely no way to suggest that there's not a disparity here. Look at these numbers. African American women are disproportionately affected by HIV in the United States. Right now, in the year 2024, while we comprise only 7% of the population, we account for 14% of all people living with HIV. On the next slides, let's look at those numbers and how they impact all of African Americans. If you take a look at the bar in green, this is Black or African Americans who are heterosexual. Please keep in mind the percent of the population that they make up in comparison to other cultures. Right next to them is the Hispanic community, and in the gold bar is the white community. So many risk factors come into play. why that disparity exists. And that is the whole reason that this project was of great interest to me. More than 40% of all new HIV cases in the United States are African Americans. That's 14,000 versus 8,000 in white Americans. So, yes, there has to be some attention given still specifically to the targeted population. So, let me answer in the next couple of slides what it is that we should do in terms of harm reduction.
Know your status and ensure HIV answers for women. Just even if you don't use it, you just got it to reference. HIV after the test, black women in PrEP, hepatitis. Hi, my name is Fatima Warren. I am the Vice President of Health Center Operations here at the Centers and Circle Health Services. In our agency, we have 9 staff that is allocated to HIV services here. We are focusing on harm reduction and to reduce the spread of HIV in our community. We do needle exchange, we do peer support, and we do anonymous and confidential testing here at the centers. We have also expanded our services to include opt out testing, where our normal primary care patients, if they are getting an annual visit, we also test and screen for HIV. That way, we are expanding the patients that are included in knowing their status. We are big on education, we are big on patient support. So, we are here in the community to provide those services to patients who don't think twice about living a risky lifestyle and may subject themselves to HIV and other harmful communicable diseases.
So in the harm reduction toolkit comes in this white, very packed bag, and they ride around the city of Cleveland from the centers and they're passing it out. I really wanted to know what harm reduction pieces are you given? So the first one is a full Narcan kit. So they talked to me a lot about the correlation between drug use, still, and HIV, not in terms of sharing needles, but in terms of just making unhealthy decisions when you are on an opiate. So the first piece is this the Narcan kit, which we've all seen and likely most of us have, with instructions for how to administer in case someone is in overdose status. The next piece in their harm reduction kit, um, I thought this was very cute. They have a stress ball. So it's supposed to be a complete kit about wellness. They have plenty of condoms. I think it's a couple of packs of those in there. They have a hygiene kit with bathing cloths, specifically bathing cloths, deodorant, shower gel, razors, just the typical things if you're outdoors, including an oral health kit. Also, within there, they have all the products, feminine products, and the kits are not, they're unisex, so everyone gets the same thing. And then they have some heart health monitoring tools. And then the final piece in the harm reduction kit that I found interesting, that I don't think I've ever really seen distributed, but on my tour, I got to put this together, is the entire drug, I want to call it paraphernalia kit, including the rubber band for tying your arm off. We're talking harm reduction here. We're also talking about the spoon. If you know heroin addicts, they boil the heroin in spoons, so there are portable spoons in everyone's kit. There's needle cleaning solution. There's band-aids in there. There's all type of tools for testing and stirring your drugs. Um, And when you use the test strips, it'll tell you whether you are having something that possibly could have fentanyl in it. So when the whole piece, and you have tons of strips in there, and it tells you the reason why. So this one tests for fentanyl, and this one tests for xylazine. So, in their harm reduction strategies, they're encouraging people to test their drugs. They're not encouraging you to use the drugs, but if you're going to use them, test them and be safe. It is beyond anything I've ever witnessed in terms of harm reduction, but every little step, every little choice you make aids at it. And my role, what am I going to do? I am going to produce for them. They have a button that's on the side of all of their harm reduction toolkits that they give out. I'm going to produce an African American one for them with just an African American figure on it, specifically in case the women or even men decide to wear that on them. And that's my gift back to the centers for allowing me such an in depth investigative piece. I hope that you've learned some tools, perhaps, uh, for this subject. And the main thing that I want you to take away is on the next slide. This patient here allowed me to be present while she was having a blood transfusion, living with HIV for more than 20 years, working in the field of HIV, dedicating her life as a social worker, spoke very candidly about how their bodies, African American women, our bodies, are often seen not as our own, and you lose autonomy sometimes to keep a relationship, and you make decisions that aren't always the best, such as condom usage. So let's examine some of what's in that harm reduction toolkit that I was able to bring home with me. Can't put our head in the sand on this one and not address these P's: prevention, perception, protection. Partnership: who are you dating? Do you know them? And pleasure: what are some ways, including abstinence, that you can make a healthy decision without putting yourself at risk?